At a time when the entire world is gearing up to celebrate the new year, to usher in the new year, precaution and caution is key. Again and again, experts have said that while India should be absolutely prepared for any onset of another wave of COVID, there is no need to panic. However, modeling techniques have shown that the next 40 days are going to be crucial. So what does the new year hold for India, and what are the precautions that India and Indians should be taking as they prepare to party and usher in the new year? Joining us now is former director of the All India Institute of Medical Sciences, Dr. Randeep Guleria. Thank you very much, sir, for speaking to us. India is stepping up its guard over COVID, particularly after what's been happening in China. Should we be worried, though?
So I think it's always important to be extra cautious, and therefore it's good that we should step up our guard, because we should not be caught off guard. But at the same time, I think it's important for us to understand that there's no need for panic. India has done remarkably well over the last 2.5 to 3 years. Majority of our population has been well vaccinated, and also we have had natural immunity. So hybrid immunity is good. We are not seeing an increase in number of cases in our country, and we are not seeing any admissions. ICU admissions have not gone up. There are no patients on ventilators. So I think we should be vigilant. We should have good surveillance, but I don't think there's a need for panic. We are in a good situation.
Dr. Guleria, there was a recent statistic that placed the number of people who have not taken their second dose at approximately 70 million. Also, those who haven't taken their booster dose is almost 70% of the eligible population. Should that now be priority for us?
Yes, I think we should encourage a lot of people who have not taken their second dose or the booster dose to come forward and do that. Many of people whom I meet, and especially patients, think that COVID is over and therefore they don't need to take the booster dose or they don't need to take vaccination anymore. I would just like to say that COVID is not over. We're still seeing a huge increase in cases across the world. And therefore, it's important that we stay protected, not only for ourselves, but for our family. And therefore, it's important that we take our vaccination on time. It will protect us from severe disease, ICU admissions, and death. And therefore, it's important that those who have not taken the vaccine understand the importance of coming forward and taking the vaccine.
Sir, as far as the BF.7 variant is concerned, even though it has been prevalent in India since September, it's not really had an adverse impact just as yet. Are our vaccines an adequate safeguard against this variant?
So the BF7 variant is basically a sublineage of Omicron. And we have data which suggests that the vaccines are effective against Omicron and therefore should be effective against these sublineages also. But I think two important issues are there. One is, what do we mean by vaccines being effective? Vaccines are effective in terms of preventing severe disease, in terms of preventing ICU admissions and death. They are not that effective against preventing infection from happening. So we may see an increase in number of people who may have infection which may be mild. Those who have been vaccinated, they may have flu-like syndromes, they may have fever, cough, body aches, and sore throat, but they will be protected against getting severe infection. So therefore, vaccines are effective and are currently still working. We will need to see how things evolve over time with new variants coming, and whether we need to then look at next generation vaccines in the future.
Now, it's also been reported, Dr. Guleria, that the next month is absolutely crucial. It had been said that there has been a pattern that the COVID wave has usually hit India 30 to 35 days after it's hit East Asia. What is your assessment? What is the next 1 month going to be like for us?
So there are two things to keep in mind. One is that if you look at the previous pattern, we tend to follow a little bit of what happens in the rest of the world. What happened initially in Italy and US, and then we started seeing an increase in number of cases. Secondly, we must also remember that this is the holiday season. People are traveling both nationally and inside a closed environment. So these factors will play a role, and therefore the next few weeks will be important in terms of close monitoring and surveillance. But I don't think there's a need to really get into a panic mode.
Now, sir, if there indeed is a wave, another wave in India, do you believe it has the potential to be lethal like what we saw in the second wave? Or do we, like the Omicron wave, have to deal only with mild flu-like symptoms?
So our situation is much or very different from what it was in at the beginning of 2021 when we were not fully vaccinated. There was not a good degree of immunity as compared to what we have right now. Therefore, I feel that currently, if we have a wave, we will see increase in mild cases, flu-like symptoms, fever, body aches, but we are not going to see a significant increase in hospital admissions, ICU care, or deaths. And that's why I feel that we should be vigilant. We should have good surveillance because one unknown factor is how the virus behaves. Will the virus mutate and become more lethal? It hasn't done so over the last 1 year, so seems less likely that it will do so. But I think that is something that we need to be vigilant about.
And so also during the second wave, we saw a decentralized approach when it came to lockdowns or restrictions. Do you apprehend that we might reach a stage where restrictions on mobility might be introduced again, or is that not something that you see in the foreseeable future?
So I don't think we'll see a lockdown like we saw in the beginning, a large scale lockdown. And I don't think that we will also see a major limitations to restriction. I would really think that we should upscale or start increasing our testing so that we are able to pick up any new variants early rather than late. We should have good aggressive surveillance. But having said that, if there is a cluster of cases or a huge increased number of cases in an area, then there can be some restrictions, but I don't see that happening in a big way.
Dr. Guleria, what does the Chinese experience tell us about the perils of going too far when it comes to imposing restrictions? Because there are many people who are saying that we should dial down our activities, we should impose restrictions on people who are dining, but China has been suffering the after effects of that. What do you think the learnings are from there?
So I think what the Chinese experience shows us is that you have to be able to change as the virus evolves. We have to evolve as the virus evolves and as things change over a period of time. So the zero COVID policy may have been good in the early stage of the pandemic, but as the virus evolved and there was good vaccination and they were having mild disease, to some extent, lifting the lockdown then and accepting that now majority of people will have a mild disease may have been a better strategy to allow the disease to spread a little bit and allow some degree of natural immunity to happen, which is what happened in most parts of the world. But somehow China did not do that. They continued to have a zero COVID policy with strict lockdowns throughout, and therefore they have a population which is vulnerable, and also their vaccine program has not been that good as what we've seen in India.
Now, do you see a scenario, sir, where given the propensity of the virus to mutate, there might be a need for periodic boosters in addition to what we've already received to keep us safe?
So, as we do for influenza, which is another viral infection and which has caused pandemics, the H1N1 pandemic and the Spanish flu pandemic, we give an annual flu shot or a vaccine based on the circulating influenza A and influenza B strains globally. Based in a similar manner, I think in the future, at least for some time, we will need to continue to have a vaccination to stay protected because the virus will mutate and it will develop features of immune escape, which can cause a higher chance of infection. And therefore, especially among the elderly and the high risk group, it may be worthwhile to vaccinate them even in terms of future booster doses.
Now, sir, we are in the middle of winter in northern India. Is there a correlation between weather and our immunity to something like COVID?
So the correlation is there for all respiratory viral infections. We see, and this is data even for influenza, that there is a surge in the viral infections during the winter months. Interestingly, this happens more in North India. In the southern part, because it's not that cold, this tends to happen more during the monsoon months or the rainy season. And it happens a lot in places like Srinagar. So India behaves differently in different parts because the temperature varies. And therefore, in northern India, this is the time that we will see increased number of respiratory infections, flu-like syndrome, and we will also see a seasonality as far as COVID is concerned in the future, with more cases happening during the winter months.
Now, sir, also there is the intranasal vaccine by Bharat Biotech that has been approved for administration. Do you believe that the administration directly into the nasal system has an added advantage?
Yes, the intranasal vaccine is a very good addition. It has two major advantages. One is the ease of administration. It's not an injection, it's just a few drops put in your nostril. So it's very easy to give to a large number of people. And for example, if you wanted to vaccinate a whole classroom, let's say a school, you could just go into the school and just put these drops in all the children and they would be vaccinated in a very short span of time. So the ease of vaccination is there. Secondly, since it starts working locally, it also stimulates the local immune system of the nasal mucosa, and it gives a good amount of what we call IgG immunity there. And therefore, local mucosal immunity is also uh, uh, acquired from this vaccination, which is an additional benefit over and above the systemic immunity that we get. Therefore, I think this vaccine has the advantage of ease of administration and better immunity both at a local level, which will decrease viral replication, and at a systemic level.
And finally, Dr. Guleria, has the breathing space we've had since the end of last year to now given us ample time to boost our medical infrastructure, including our oxygen plants, in the event that there is another wave?
Yes, I think the last 1 year after we had Omicron and there was this worry, there has been a lot of investment by the government in various sectors, including improvement of infrastructure. So whether it be oxygen plants, the PSA plants, the oxygen storage plants, or a plan in place to how to upscale our facility in case there is a surge in the number of cases has been done in terms of ICU beds, in terms of ventilators, oxygen, and overall arrangement for as far as medication is concerned. So we are much better prepared for an outbreak now than ever before, and I think that is something that we've learned over the last 2.5 years, and are now implementing that for the future.
All right, thank you very much, Dr. Randeep Guleria. Always very reassuring to hear you. Your experience is extremely valuable, and we wish all of our viewers and you a very happy new year.